Hi, my name is Giang Nguyen, student ID 320865882. And in today's presentation, I will discuss the health challenge facing by childbearing Aboriginals and Torres Strait Islander women and their family. In particular, I found a health challenge that makes most Aboriginal women struggle are mental health disorder. So mental health disorder is a common health issue that affects around 300 million people worldwide and is high relevant in the woman. This is about 1.5 to 2.5 times higher chance in the woman to have one mental health disorder in general public. What is really important is that pregnancies often make the condition turn worse or develop a new mental health conditions in the woman, according to Cantwell in 2021. And it's up to 20% pregnant women experience with one of mental health issues during their perinatal time. And this percentage is particularly high in Aboriginal women. It is 2.5 times in Aboriginal women compared to non-Aboriginal one. This causes many drawbacks for women while experiencing the pregnancy periods, and it also affects their postpartum state. So the most common mental health disorder during pregnancies are depression and anxiety. There are one top-tier reasons that leads to drug, alcohol consumption, and smoking in women, especially in the genus women, including pregnant and breastfeeding ones. Data also show that almost 90% of women have mental health problems in the 5 years perinatal period, and 9% have mental health problems in the year preceding pregnancy, which is definitely considered alarming. In these presentations, the current situations of Aboriginals pregnant women with mental health disorders will be discussed, and how the maternity and mental health service in Australia could support Aboriginal childbearing women, as well as the role of the midwife in the provisions of culturally self-care in support Aboriginal women with mental health issues during their pregnancies. So, we know that the factors that lead to these massive mental health disorder problems in Aboriginal societies, especially in women, are the historical aspects and the process of colonization, which affect law, culture, authorities, and punishments among the communities. Many families in this area are stuck in the loop of alcohol-related to crime, while family environments clearly affect people's mental health. Furthermore, racism and discrimination are also factors that affect the mental health of Aboriginals and Torres Strait Islander women, which lead to their poor general health and their poor mental health status in perinatal time. So, how mental health disorders affect the woman and the baby? The high level of stress and associated mental health distress can affect significantly on both the mom and the baby. So regarding for the newborn babies, the most visible impact are the fetal distress, the premature birth, the low APGAR score in birth, which lead to the high percentage the baby end up to special nursery care or neonatal intensive care, the low birth weight, and also can lead to the very poor gain weight during their growing up times, the poor breastfeeding outcomes, and last but not least, a poor bonding and attachment between the mom and the baby. Not only that, it's also affected the baby for long term. So these babies are more likely to develop problems in their behavior, their psychologies, and their development during their growing up time. So how about the moms? The mental health issues can increase their risk of substance abuse, including alcohol, drug, and tobacco. And this rate is about 90.5%. So what does it mean? It means that every 5 Aboriginal women get pregnant, one of them will use cannabis or at the same time smoking during their pregnancy time. Mental health disorder also make the woman to get a higher risk of getting sexually transmitted diseases, STI, suffer from family violence, poor nutrition. So how the maternity service and the multidisciplinary teams in Australia can help the women, especially the Aboriginal women, during their pregnancies with their mental health issues. So fundamental to improve the outcomes for Aboriginal pregnant women is to engage them in antenatal care. So then they can receive appropriate care for the full aspect. To do that, the multidisciplinary team of the maternity service have to work collaboratively in providing a woman-centered care with fully cultural awareness. So who are they? What are the team members? So the team members include firstly, and very important, very essential, the Aboriginal health worker or Aboriginal community worker. So they are the people who are fully aware of Aboriginal culture and Aboriginal tradition. They help all the team members in any activity under the cultural and traditional awareness of the Aboriginal community. They also provide the translations to the women, especially those experience difficult in communicate with healthcare providers during their language barrier. They also provide any financial support to the women who have a problem with them. They attend the appointment with the woman and then they engage the woman and the woman family with the healthcare provider team. Secondly is definitely the midwife and the nurse. They are the persons who support a woman with professional maternity knowledge, including antenatal care, birth, postnatal care, and of course breastfeeding support. The third one is the psychologist and mental health team. They are the persons who provide mental health assessments, mental health support, and mental health management to the women who have any problem with mental health. And last but not least is the medical team. The medical team include any GPs in the communities and obstetricians at the hospital level. They provide medical care, medical intervention to the women as well as medication management indicated in each one. So now we go deeper in the role of the midwife. So the midwife play a vital role in provide a maternity care to Aboriginal women, especially those with mental health issues. So how can they do that? Firstly, midwives are often the primary healthcare provider for the women, especially with most Aboriginals who live in rural and remote areas, because they're very limited to access health service in the hospital. So midwife is the primary healthcare provider, is the first one, is also the one to close and contact oftenly to the woman. Therefore, is to give them a unique position to identify any potential mental health concerns in the woman in the very early stage of the condition. As a well-trained staff, the midwives are equipped with knowledge and skill to let them be able to perform assessment for the woman for the risk factor for mental health status, and they also can monitor any signs and symptoms of the conditions. Furthermore, the midwives provide emotional support to the women. They also offer reassurance in the case that the woman have anything concerns, and they give information, explanations regarding any concerns related to not only the pregnancies but also the mental health conditions. To do that, the woman can understand more about their conditions, reduce their stress, And also the midwife can reduce the stigma from the family of the woman and the community about the conditions. And in the case necessary, they refer the woman to specialized mental health service, such as psychologists, psychological midwives, psychologists, or psychiatrists. They collaborate with other healthcare providers to provide comprehensive care for the women with mental health concerns. Last but very important, last but not least, continuity of care in midwife practice has been reviewed, has been shown to improve the outcome of mental health issues in pregnant women. In conclusion, mental health disorders are one of the most common problems among Aboriginal women, especially pregnant women, and it could lead to serious problem impact on both the pregnant woman and the baby. To solve this problem, the midwife takes an essential role in providing culturally self-care in practice, as well as collaborate well with other multidisciplinary teams to provide a comprehensive care to the women who experience with mental health issues. Thank you for listening.